Sunshine, it's our sunshine.
Hello, I'm Dr. Kushal Hippalgaonkar, orthopedic surgeon working in Sunshine Hospitals, Hyderabad. Today I'm going to be talking about polytrauma. Now, polytrauma is a term that we used for any patient who has multiple injuries in the body. This typically happens when patients are in an accident, that is a two-wheeler hitting a four-wheeler, or a patient falling from a height like a terrace of a building. So these kind of patients typically suffer multiple injuries. Now what that means is that let's say a patient has suffered an accident, there can be injuries to the head, to the chest, to the abdomen, to the limbs, fractures anywhere in the body. So that contributes to polytrauma. So what is the importance? Polytrauma is why it needs special mention is because polytrauma can be life-threatening. While just a simple fracture in my forearm or the leg will not be a life-threatening injury, polytrauma, most of them are potentially life-threatening. That's why the importance, and that's why prioritizing which injury is life-threatening, which needs urgent care, is the most important aspect of polytrauma. So when patients come to our hospital, we prioritize which injury is going to be managed first. Like for example, a head injury causing a clot in the blood accumulation in the head needs urgent care, whereas a fracture in the forearm can be treated at a later date. So that's how we prioritize, and we go by the stage wise management. Around 1 to 2 weeks stay in the hospital is necessary minimum for these kind of patients, and we take them up for surgery say 1 or 2 or 3 times and try to treat all the different injuries that have happened. So this is just say 50% of the importance of treating polytrauma. The second importance is that of rehabilitation. So that involves physiotherapy at home, exercises, mobilizing the patients around in a wheelchair or with the help of a walker at home. So gradually over a period of about 6 months, the patients get better and then completely heal. Now in Sunshine, there is about 1 polytrauma patient or 2 polytrauma patients that come per week. We have strict guidelines, that is we've set up a polytrauma committee in which 8 to 10 surgeons are there, including the MD, in which discussions happen about each polytrauma case and which aspect of the polytrauma patient needs treatment first and which one can be delayed for 2 to 3 days. Once that is over, all the entire team meets the patient and the relatives and then completes their counseling, followed by which there is the surgeries that happen for different injuries that the patient has suffered. So this is in brief about the importance of polytrauma. Thank you.
Sunshine, it's our sunshine.